All right, well, good afternoon. Welcome to the Project of Primary Healthcare. My name's Noah, and I'm a prevention specialist.
I'm Michaela. I'm also a prevention specialist, but today I'm going to be playing the role of client.
We're here to introduce you to our new at-home HIV testing program. Did you know you can request a free HIV test to take at home? You can.
Wow.
So in this scenario, I'm going to pretend to be the prevention specialist. I've just received a request from Michaela to have me send her an at-home HIV test.
And I put that request in from our link, so you can find it on our website and also on social media as well.
Did I mention the tests are free?
They're free. Yeah.
All right. So I'm pretending to call Michaela. Hi, Michaela. This is Noah. I'm a prevention specialist at the Project of Primary Healthcare. How are you?
Hey, Noah. I'm doing well.
Great. Well, we received your request for a free at-home HIV test. So if you have some time, I'd like to do a brief 10-minute consultation with you, and then we can get that free test out to you today. How does that sound?
Absolutely. Sounds great.
Great. So I'm just going to take some demographic information. I'll ask you your date of birth, address, any race or ethnicity, and if you've heard of PrEP. Have you heard of PrEP?
I have.
Okay, what do you know about it?
I know it's a pill that you can take once a day, and it helps prevent an HIV infection if you were to be exposed.
Awesome. Yeah, it's up to 99% effective when used as directed. Now, have you been taking PrEP in the past year, or are you currently taking PrEP?
I'm not taking PrEP right now.
Okay, well, we can talk about if that would be a good fit for you as well.
Excellent.
I'm going to ask you some brief questions about your health history. At this time, I would ask Michaela some questions about her sexual partners, STD history, as well as a couple of other factors that would influence our conversation. Okay, Michaela, well, it sounds like the at-home HIV test would be a good fit for you. And based on what you told me, you may be a good candidate for PrEP as well. So let's go ahead and get this HIV test sent out today. And then once you've let us know your results, we can schedule an appointment with the provider for PrEP.
Sounds great. Thanks, Noah.
I'm going to include in the box a letter with all the instructions. In the upper left-hand corner, there'll be a code. I'm just going to ask that you take a picture of the code along with your test result and text it to our secure phone number, which I will have listed.
Wonderful. I can do that.
Awesome. And one last option. Do you feel like you'd like to do the test with me live over Zoom, or would you prefer just to do it by yourself?
I think I'd like to do it just by myself.
Great. Well, if you change your mind or have any questions or concerns, don't hesitate to give me a call. All right. I'm going to go ahead and send that to you today.
Awesome.
Bye.
What a nice person. I couldn't have asked for a better person to interview me about these things. Come in.
Hello, it's your local mailman.
Oh my gosh.
You have a package.
I wonder what it is. It's my at-home or a quick HIV test. You can't see it because of the light. HIV test. So when you receive it, you'll, like Noah said, get this instructions on how to do it. And I'll briefly show you kind of what it's going to look like. So you get this handy little box. It's a test that takes 20 minutes. And just like any other HIV test, there is a window period or a time when it could have inaccurate results. So say I had sex yesterday and maybe I was exposed to HIV. This test isn't going to be able to tell me if I were to have acquired HIV from that exposure. This one has a window period or a time frame of 6 to 8 weeks. Is that correct? So 6 to 8 weeks. Anything in that 6 to 8 week period, you'll need to retest essentially. But this is good for knowing from the day you were born up until about 8 weeks ago. So you get this handy dandy little instruction manual, and it gives you all of the directions. But basically, this is just a mouth swab. So you can open it up. I've never actually opened this one up though. You get a little tube, And again, for those people who love to read instructions, it's like listed out very easily step by step here. Maybe I should follow them. Anyway.
We're doing an abbreviated version. But
yes,
please read all the instructions.
Yes. So what you're going to do, you have this little tube. We will make sure that the tests are not like expired or anything. All tests do have expiration dates, just part of their safety. So that's not something you should ever have to worry about. This thing's awesome because it has a little holder. So the solution that your sample sits in sits right there. And then you get an OraQuick mouth swab. So this test is looking for HIV antibodies. And what you're going to do is take the swab down. Can I use this? Okay. So what you're going to do is take it down and then you just swab your gums. I'm going to make sure to do it correctly. There's also a picture that tells you exactly what to do. So you just swab right around the top and then right around the bottom. My mouth is super dry. It's like insane. All right. So then place it in. And then you wait for 20 minutes. On these tests, it'll tell you how to interpret the results. But there's going to be a control marker, and that will pop up next to the C that you see. You're going to see that no matter what. If you do not see that, that just means that the test, for whatever reason, didn't work properly. Maybe it got stored outside of temperature range. Maybe it's a problem with the batch. But that's why they have that control marker, so that you can tell. So if that control line doesn't show up, then you need to just let us know and we can send you a new test. If you see one line and that control mark, that just means that this is a non-reactive test. It didn't detect HIV. If you see two lines, one by the control marker, one by the T, that means that it may have picked up signs of HIV antibodies. And it's what we would call a preliminary positive, and we need to do some more testing. Every HIV test has a chance of false positives, which is why it's very important if you were to get a preliminary positive that you just contact us. We can get you into services and get you in for any additional testing very easily, no matter where you're located. We have partners all across the state that we can help you get in contact with. So let's just say 20 minutes has passed. And I'm ready to send my test results back to the prevention team at the project. I just take my little test stick. You can hold it, you can place it, whatever. I don't know how people have done it necessarily in the past, but we just need to be able to see that this is what the test result is. So take it with your number, the ID number that's at the top left, along with this little stick, and then shoot us a picture, a text, whatever, so we can just confirm the results. All of this also has our contact information, so you can contact us at any time. If you're nervous, again, about doing this by yourself or you're not sure how to interpret the results, absolutely give us a call. We can also set up Zoom calls and do this with you. But this is a great option for folks who maybe live far away from clinics, don't have access to HIV testing where they are, have high risk for COVID complications and they'd like to just avoid that. Or if you're just, wanting a confidential test, it's a really great option for you. Let's see, what else?
No, I think you covered it. We're excited to be able to offer this free option. And remember that no matter what your result is, you don't have to take the next steps alone. Mm-hmm. We are here for you.
Yeah, absolutely. And this is just a really nice way because the first step is knowing your status. So this is just another way that you can do that for yourself. Lots of options for people. So really awesome.
Thanks, Michaela.
Yeah.
Thanks everybody. We're here to answer your questions. Mm-hmm. Talk to you soon.